This patient was referred to me 2 years ago for endodontic retreatment of teeth number 14 and 15. These root canals were done 10 plus years ago according to the patient. Alright, so take a look here. Tooth number 14. Alright, you can see previous root canal. Post here. Wait a minute. What is this one? What is this post? Okay, let's look at a different angulation PA. You can see by the way periapical lucency there. Let's look at another angulation. Whoa! Where did this post go? They perfed it. They perfed the distal buccal canal. Boom, right there. So, has to be pulled, unfortunately. So he came back today for me to look at tooth number 15, to reevaluate tooth number 15. The dentist is worried that if he puts a dental implant here, if there's an infection on 15, it could affect the dental implant. And that's the x-ray from today. This is the x-ray from 2021, so from 2 years ago. From 2 years ago, as you can see, 2021, from 2 years ago, that's the x-ray from today. And, you know, zooming out, I don't see any issues. This patient has no symptoms. Percussion was within normal limits, palpation within normal limits, no sinus tracts or fistula. Probings were 2 to 4 millimeters. So I told the patient, I'm not going to... And this root canal, by the way, as I said, this root canal was done over 10 years ago. So I told the patient, just go ahead and get your dental implant. Come back and see me if there are any issues. But I'm not going to redo this. So yeah, I'm not going to redo this root canal because I don't see anything. Again, no symptoms. This patient has had no symptoms for the past 10 plus years. Maybe there's something, I don't know. But right now, why rush it? Why rush it? You can always come back and see me and I can redo the root canal on tooth number 15. And if there is an infection, let's say there is an infection here, it will not affect the dental implant. It will not affect the dental implant. This patient was referred to me for endodontic retreatment of tooth number 19. The root canal was originally done a few years ago, and then a year ago, patient says he developed a swelling, was referred to another endodontist, and the endodontist redid the root canal. But patient says ever since the root canal was redone a year ago, the symptoms are the same. The symptoms never went away. The swelling comes and goes, and he's seen the endodontist a few times, and the endodontist every time says to give things more time. So it's been over a year, and he still has a swelling on his gingiva, the gum, as he called it. Anyway, so take a look here. Let's look at another angulation of this tooth and take a look. So when I examined the tooth, there was a buccal parielis associated with the tooth. Tooth was tender to percussion and palpation. And when I probed the tooth, probings were crazy, like 9 millimeters plus. So looking at this tooth, the root canal was done originally, then was redone by an endodontist with the buccal swelling and 9 millimeter plus probings. And also take a look at the way these canals were shaped. You can see, look like a Coke bottle preparation. That means Gates Glidden was used, very likely. You can see, so very likely this tooth has vertical root fracture. So no point in trying to save a tooth like that. He would be better off extracting the tooth and putting a dental implant in there.